CBT focuses on thoughts, feelings and behaviours and our physiological symptoms. So thoughts like I will fail and I'm worthless can then lead to negative cycles and can make your behaviour change, and also the way that you feel about yourself can change. So within CBT, we would look at these thoughts and start to challenge them to see if we can find any more balanced and alternative or maybe positive thoughts. We would look at your behaviours to see what's working well for you, what isn't working well. And then we would look at ways to cope with the physiological symptoms that you might be going through and find some coping strategies for that. If you had other types of therapy that haven't worked for your depression, you might then have high intensity CBT to try and tackle that. This then would help how you were feeling about yourself and hopefully make you feel more positive and balanced by the end of the sessions. So CBT is very goal orientated, it's very focused on the present and very practical short-term therapy. So high intensity CBT is different to low intensity CBT, as low intensity CBT is more guided self-help and teaches you coping strategies. High intensity CBT is more structured and more in depth and will work on specific anxiety disorders. So with this, the sessions last for about 50 to 60 minutes and we generally have sessions once a week, or it can be bi-weekly sometimes. Low intensity CBT is very kind of manualised. You've got 6 sessions and it's a standard process. High CBT is more tailored to the client. The sessions are delivered by a high intensity trained CBT therapist and are collaborative in real time, focusing on thoughts, feelings and behaviours. High intensity CBT is for anyone that has moderate to severe depression or anxiety disorders, and it might be for those that have already tried other options like counselling or low intensity CBT. You've got different bases all around Birmingham, so it's accessible, and if you want face-to-face sessions, there should be a base that's fairly close to your house or just like a quick bus ride away. So how does high CBT work? So it's a very structured process and follows different formulations for different types of presentation. The first 2 to 3 sessions we would focus on assessment and goal setting. We usually use something called SMART goals to keep the goals very specific, reliable and measurable. For the rest of the sessions, we'd look at identifying different thought patterns and behaviours. We would then work on challenging these thoughts, modifying different behaviours, looking at different coping skills. So it will involve trying different things out. Also having some homework. We might work on behavioural experiments or behavioural activation, all depending on what it is you're bringing into the sessions at the moment. If you wanted to come into the service, so you can either give us a call or you can go on our website. When you go on the website, a little chatbot, limbic chatbot pops up in the corner and you can do a full referral. In summary, high CBT is a deeply structured therapy that helps you learn tools to overcome your own mental health challenges.